No, I don't have that.
Angela?
Mute me.
I'm here. I'm here.
Yes.
I'm here. I'm here.
And
Hey, Robin, can you make sure that everyone down there has their computers muted and
Okay,
their volume down? So I'm getting a little bit of feedback.
thank you. Okay, I just muted mine. Everyone online, I have Susan and I have Angela and I have Pastor Michael. Can you all hear us?
Good to go.
Yes, I can.
Got it. So we do have a quorum.
so I just,
You can just call the meeting to order.
Okay.
Yes.
all right, good afternoon, everybody. This is the School Health Advisory Committee.
Your agenda.
Yep. Everybody should have an agenda. So we're gonna start, we're gonna call the meeting to order and start with the Pledge of Allegiance. So everybody could please stand. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So our first order of business is that we need to have approval of the agenda. Do I have a motion to approve the agenda for tonight's meeting? Thank you, Mr. Pierce. Do I have a second?
I'll second.
All right, so the agenda is approved.
Yes, about.
Oh, all in favor, thank you. All in favor of approving the agenda, say aye.
Aye.
Online,
Aye.
thank you. Pastor Michael,
Aye.
thank you, and
Aye.
thank you. The agenda is approved. All right, our next order of business is for public comments. Do we have anybody for public?
No.
All right, so there are no public comments, so we're gonna move on to approval of the minutes from July 29th. We received them digitally. We also have print copies in our packets for today. Are there any?
Minor correction in my last name. PEA.
PEA, thank you, sir. Thank you.
That's not minor, that's important.
Okay. And I'll just add, I'm picky, I go by Coburn Smith. Coburn Smith, both. Gotcha. Equal opportunity spouse, thanks.
All
But
right.
everything else.
So we have a motion to approve the minutes from our July 29th meeting.
I'll move guys to it.
Thank you. And a second?
I'll second.
Thank you. All right, all those in favor of approving the minutes, please say aye.
Aye.
Online,
Aye.
Pastor Michael?
I'm a aye. Can you hear me?
We can, thank you. All right, so the
And
minutes,
Susan.
they voted it, yeah.
Thank you.
And Angela said it at the same time. All right. So now we're going to move on to our next order of business. And we wanted to revisit our purpose of the advisory committee. So if you have your advisory committee notebooks, if you could please open to section 3. These are the bylaws of the Beaufort County School District Health Advisory Committee. And Roman numeral 2 of the bylaws speaks to our purpose specifically. And so our purpose is to review components and curriculum materials reflective of what is stated in the South Carolina Comprehensive Education Act. And then the second part of that is that the local school board uses the instructional unit made available by the state of South Carolina pursuant of section 593220, or local boards can develop or select their own instructional materials addressing the subjects of reproductive health education, family life education, and pregnancy prevention education. So that's kind of our purpose, and we're here kind of meeting to go over our current curriculum and make sure that we are compliant and doing what all we need to do.
I have a question.
Yes, sir.
When you look at the Title 59, it actually was approved in 1988, fairly specific in terms of some of the guidelines.
You're stealing my thunder.
Well, however, my question really is, has the Beaufort County, in general followed those guidelines, or have they deviated from those guidelines? What's the history?
I've only been in the district since 2017. So, and that was 2 superintendents ago, I think, since then. So, I think there has been a lapse, just because of a transition, I would say. This is my personal opinion. So I think our current administration and superintendent and instructional services department is trying to get us back into compliance and making sure that we're doing what we're supposed to be doing. So, but speaking of, if you'll turn to section 4, where it does talk about the Comprehensive Health Education Act. The first section, the 593210, goes through and specifically defines what is meant by things such as comprehensive health education or reproductive health education, family life education, and gives us a definition so that we can have a fundamental framework of when we read about, it says that we're doing this with family life education, we all have the same understanding of what that means. So I wanted to make sure everybody had a chance to review those. It's the first 1, 2, and 3. And then it goes into a little bit more detail about different components. If you flip the page, and let me know if I'm going too fast, so I don't want to go. So section 593230 talks about local school boards to implement comprehensive health education programs, guidelines, and restrictions. So section A under that talks about that the guidelines have to be developed by the board. Each local school board is to implement the following program of instruction, and that's where you reference the in 1988-89 school year. It talks about grades kindergarten through 5 and their instruction for comprehensive education under number 1. Number 2 talks about 6th grade through 8th grade instruction, and it lists the units specifically of what we are to cover.
Before you go further, I'm not seeing.
Oh, so on,
4.
Yes.
Under 4. And even the other one, it was like.
We might have moved them around.
oh,
That's part of.
so
the
maybe it's section 3. It should be if you, so I apologize.
Section 3.
The section 59.
Well, mine's under 4, so I messed up somehow.
So section 59 in the original is under 3, correct? Yeah.
Okay, all right, so mine just somehow
You
got
got, and then
whonked out.
then you're looking at the bylaws. The bylaws,
The bylaws are then 2.
yeah.
Okay, well, my apologies,
Yes.
my book.
Which one?
I'm on the section 59, the Comprehensive Health Education Act.
So that's under section 3.
Okay. I'll fix my.
Yeah.
Thank you. All right, so apologies to anybody online too, that threw you off. So under 593230. Section 2 talks about 6th through 8th grade, and section 3 talks about at high school. And I'm pointing those out because that's what we're focusing on is the middle school and high school curriculum. So I wanted you to be aware of what is required of that. If you flip the page, number 4 and 5 and 6 gives further instruction on what can be adopted. Also, as far as what type of materials can be used. Then if we go to the bottom of that page, again, if I'm moving too fast, please stop me. It again talks about the local school boards may use the instructional unit made available by the board, meaning the State Board of Education, pursuant to Section 959-3220, or local boards may develop or select their own instructional materials addressing the subjects of reproductive health education, family life education, and pregnancy prevention education. So just as we're reviewing what the state adopted curriculum is, but we do have the right to create or choose a different curriculum if that's what we want to recommend to the board. The next page
You have to
is,
say it again on the next page with the tab are we under
it's still under that 59 section.
3210.
We are under 59-32-30.
Item B, and then you're now moving
To,
to item D.
yes, sir, I'm gonna move to D. Oh, thank you.
3230.
So have her flip the page one more time.
Got it, I can see it. Thank you so much.
Then the page on your right at the top says D.
Gotcha.
Okay. This talks about contraceptive devices or medications. We're not allowed to introduce those or distribute them. Letter E talks about any course or instruction in sexually transmitted diseases must be taught within the reproductive health, family life, and pregnancy prevention education components, or it has to be presented as a separate component. So that has to be included in our review. Same thing with pregnancy prevention. But it has to be taught. Anything that is pregnancy prevention must be presented separately to males and females. So we have to segregate our classes based off of gender. And then G under that same section talks about in school year 2015-2016, we have to annually provide age-appropriate instruction in sexual abuse and sexual assault and prevention. And that is the Gavin's Law and Aaron's Law. Just so you guys can make that connection. Okay, we're gonna flip the page one more time. And we're gonna go to the last section, 59-32-90, which is gonna be on that right-hand side. It's the very last section, and it talks about films, pictures, or diagrams, and any comprehensive health education program in public schools must be designated solely for the purpose of explaining bodily functions or the human reproduction process and may not include actual or simulated portrayals of sexual activities or sexual intercourse. And I wanted to point that out because we are, in reviewing the curriculum, we will have pictures and graphics, and the online component does have videos. So I just wanted to keep that in the forefront of everybody's mind. So with that being said, I know that was a lot to digest. Does anybody have any questions? I don't want to sit and read to you guys, but also I want to make sure that you guys know where stuff is. So when you are reviewing and you have questions, you can, you know, kind of have a reference of where to go back and check. All right. Online, were there any questions? Okay. All right. So our next agenda topic is review of resources. So our members online, you got this sent to you digitally. We do have print copies. If we need to get those to you, if it would be easier. But here you guys have, yellow plastic folder. And in your folder, there are two packets. One says middle school at the top, and the other one says high school at the top.
I emailed those to those of you online probably about 15-20 minutes ago, prior to the meeting. So you might want to check your email.
You have one? You need one?
Yeah, I'm good.
Okay.
I read this so much, I feel like it's a refresher's course. Respectfully.
All right, so, we developed these packets to hopefully help us, review the material a little bit easier, and give everybody, so when you're reviewing and Dr. Pierce is reviewing and Ms. Clyburn Smith is reviewing, and we come back together, we can all have apples to apples, rather than, it just gives us a framework to kind of follow. For the purposes of tonight, I do think my thought process was that we would go through as here and start to review one of the units as a group so that we could have those conversations openly, and then you have a model for which to go by as you go through and your review. We thought about, instead of everybody reviewing everything, we would have units that we would assign groups of people so that then when we come back for our next meeting, those groups, kind of subcommittee-ish, if you want to call it, could then report out their findings, and then we could have those conversations, if that makes sense. Because there's 17 units at the high school and 10 units at the middle school. So I feel like splitting it up and then coming back together, and then we need to make a motion to officially adopt that format, okay? Just making sure.
No, ma'am.
All right, so that being said, before we go through this review document, I would like to see if we could go over the online, just so that everybody understands where to go, what it looks like, because we don't have hard copies, it's all online.
Those are the things that Ms. Vogt sent.
Yes.
Okay.
Yes,
Already seen.
yes, no surprises. I shared that with y'all last week.
Yeah.
When she's in.
Yeah,
If you want to share your.
Yep.
You can share and then everybody can see.
okay. All right, so this is our online. How do I get that? You see that bar across the top? All right. Oh yeah, that's my toolbar.
I was gonna say.
Yep. All right, so just so everybody understands what they're looking at. There are 3 options with this curriculum. You can get just the textbook, which is this Glencoe Health 2022. You can get the textbook with the reproductive health supplement in it already, and that's with the human sexuality. Or you can just have the supplement by itself. So that's why when you log in, you see the 3 different textbooks there, just so you know what you're looking at.
Is this for middle school or high school?
This is the high school
High school.
one, yes. So I'm gonna click on the middle one.
Highlighting that it says Glencoe Health, the blue square right there. The middle school does say teen health. They all look alike, but after you've looked at it as much as we have, you can tell. So just make sure to keep that in mind.
All right, so I'm gonna do the one that has both because we're gonna be working in both. That's just me. So whatever you feel comfortable with, because it can be confusing when you're looking in here, which one, what am I looking at, what am I not?
Yeah, excuse me.
Yes, ma'am.
If we go further, I've been in there and I didn't recall seeing that first one was only 2.
You might have been in the middle school one.
Okay.
It looks very similar.
Yeah, they,
So we were
the
doing
difference
high
between
school,
middle, this is the middle
and I went
school.
through-
For the example. No, we're
This is
looking
only
at
an
both middle
example.
and high.
Gotcha.
This is just an example
This
that
is a
we're
practice,
modeling
yeah.
for.
Gotcha,
The
okay.
difference literally is the background is white and they changed the sneakers to something else. So like that's
Yeah.
literally the difference in the two. Like it's hard to tell.
This may be neither here nor there. I went through quite a bit of it. And one of the things, as I was even this, what you gave us the last go round and looking at, I know it's a lot to do with alcohol, tobacco, and other drugs. Is anything associated with firearms at all in the school system here of this?
Not that I know of.
Or
I haven't
there's
seen
Health
anything.
and safety?
Yeah.
Okay.
There is a unit on safety at home, a lesson on safety at home. So,
Okay.
but I don't think anything explicitly to firearms and weapons.
Very good.
So I think for the easiest way to tell you where to navigate from here is if you go to browse this course from the dashboard, and these are exactly the same for either one. So the modules are not numbered online, but they're numbered in the textbook. So that's why on your sheet you have both the module number and the title of the module. From the course browser, the modules at the top will be the textbook. And then at the bottom, you see where it says here, supplement human sexuality modules. That's how you get to the ones that are specific that say supplement. So if we wanted to go into the supplement, we would hit this arrow right here to the right that says view more. And when you click on view more, it takes you to the individual lessons for the reproductive health supplement. The high school has 8 modules in the supplement. So, does anybody have a preference for which unit we do together? Or we just go with the first one?
First.
Okay, all right, so I'm gonna click on the first one. So here is the module, and it doesn't. Where is the text? So this is a supplemental resource. I don't know where. This was different than what I have in middle school. So I'm wondering if we don't have to create a class because the class should already be in there, right? This is insane. Oh, maybe here I'll have to go to the print edition or the text. Yeah. So what I just shared with you was the teacher side. This is the student side. This. So. Oh, but it's gonna make me go through the whole book. I can't fast track it. It's no fun.
Can you change like the page number on it?
Yeah, but I gotta know what page number to go to.
Oh.
And the course isn't gonna tell me that. Yeah, but- It's not gonna be fun. Okay. Well, maybe I can find in the table of contents, once it loads. It'll tell me what page to go to. So it says page 1. Here we go. Yay. That wasn't as, the supplement's gonna be a lot easier to navigate than the textbook.
Yeah.
All right, so here's the first page of the supplement. And it's telling us the 3 lessons for this module. And then it goes into the first lesson. So we go back to our packet for the high school. I've already pre-populated the resources for you. So this goes in order of how this sheet is. If that makes sense.
Hold on, not quite.
You're
I'm here
fine.
with the high school.
Yes, ma'am.
And you got another something.
Yep,
else?
so you're gonna unclip it and take this first page off.
And I have a question right here.
Yes,
All of
ma'am.
this. Is it possible to get a book? Only because I go to my retina doctor tomorrow and it's very hard as I look on my, I don't like that screen. It was a lot to handle for me.
Right. But the high school portion is online and middle school
Okay.
portion is what we use, so we want
Okay,
to keep to what we be moving forward.
okay.
Thank you.
I prefer the hard copy too, so I'm right there with you. So in your packet, so again, there's a middle school one and a high school one. They look very similar. You would put your name at the top of the sheet. For this first one, we're reviewing the supplement. I filled in the copyright date. I filled in the grade because this is intended for high school. And then you would put the date that you review it. Not that it matters, but like, as far as like if it's August 10th versus August 19th, but obviously we would want to keep this as data for us of when we last reviewed the document. The directions are pretty simple. We're assessing the acceptability of the above curriculum based on explanations of the school and community for health education materials, state and local policies, frameworks, and standards that guide health education and health education needs of students. Now, that was why I went over all the Comprehensive Health Education Acts and our bylaws, so that we have that foundation for that. So there's 3 steps. You will determine if the text, pictures, graphics, and other materials are appropriate for the intended audience. So we're saying this is intended for high school students. They avoid promoting biased or stereotypical perceptions of individuals or groups on the basis of personal characteristics. And then lastly, and I put it in bold and italicized it, are consistent with state statutes, state or district policies, code, and frameworks. So that's really kind of what we're making sure is the curriculum we're using complies with what it needs to comply with.
You don't know what district policy.
It's our policy is the state policy. Makes it easy. All right. So any questions with this front page for this unit? So if you flip that page over, you'll see the title of the module, which should match what we're looking at online, which the first one for high school is called Sexuality and You. You'll see that there are 3 lessons for this module. You should see the names on your sheet match the 3 lessons. I did put page in the curriculum, but that was when I thought we would have a hard copy, so that's probably not as significant as, so if you can't figure it out or find it, it's not life ending. But there's a comment section for you to make comments about each one of the lessons. And then there's a note section for you to just kind of make notes of that module in general. So that you can record whatever it is that you find, whether it's, I don't see any issue with this, or it mentions X, Y, Z, and we probably need to look at that or address that as a committee. But just a place for you to collect your thoughts and observations. Are there any questions about that page? Online, are we still doing good? They're probably lost because they don't have the document in hand, so I apologize.
We're,
Oh, Pastor
this
Mike.
is Pastor Michael. I can tell you that it's probably twice as hard to do this online than it is there with the materials. To keep up with all the different, I got 2 screens going at one time right now and still can't keep up with all the changes and what's going on. So I think that to get a hard copy in everyone's hands is going to be a good thing, if there's a
Okay.
way to do that.
All right, you want-
I'm sure others on the call are just as confused. But we have it all pulled up. Everything's up here. It's just using 2 screens. You got to still keep flipping back and forth.
Yeah, it's a lot. So, and we'll definitely get you the, hard copy. So I appreciate.
And then I had a question. I don't want to go back and labor over other people's time because I know that I was unable to, this is my first meeting I've been able to attend. And so I'm sure some questions have been answered, so I can call later and ask them. But the material we're going over now, is this to be put into the next school year, or is this for this school year?
We'd like to do it this year. The idea is after we move through this process to create a curriculum map, which is what we've been doing for health, regular health for middle school and high school and elementary school, is to move forward with the recommendation and then creating that curriculum for our students in middle and high school. So this year.
Okay, so they're not teaching this currently this year, they will be teaching the same half of the year?
You have to say that again. You kind of went out.
So they're not teaching this stuff now in school, they're just the second part of the year. I mean, school's already started, so they're not in health class right now learning?
If they are in health, they will get everything but this. And then by the end of, hopefully sooner rather than later, before the end of this semester, this would be approved, and then they can go back and add this in at the end of the semester.
Okay, I got you. I just wanted to just try to kind of figure out a timeline here. Okay, got you.
All right, good questions though. Thank you. All right, so we're gonna move to the next page, which is, it's got blue at the top. So Pastor Michael, in an effort to keep you from having to go through so many documents in front of you at one time, we've gone through and pulled the reproductive health standards through all 8 standards for each grade level, so that you can then go through and see the standards and not have to have another document that you have to finagle through. So at the top in the blue band, it lists the standard. There are 8 health education standards. However, not all 8 standards have a reproductive health performance indicator. So if it did not have a performance indicator for reproductive health, it's not going to be on here. Does that make sense?
Yes, very much.
So, all right, so the first standard has to do with comprehending concepts related to health promotion and disease prevention to enhance your health. And then underneath that standard are the following performance indicators. So what you will do after you write your review and go through the information for the module, you're going to go through each one of those performance indicators and place a check mark next to it if you feel like that module contained that performance indicator. So for example, if we look at growth, development, and sexual health and responsibility, the first performance indicator says, describe physical, social, and emotional changes that occur during adolescence. So we would go through, after reviewing that material, if we feel like this module addressed that performance indicator, we would put a check mark there. If we didn't, then we'll just move on. So this is going to help us.
Question?
Yes, ma'am.
This first one, describe physical, social, whatever, is it
Right.
gonna be under that first sexuality and making responsible decisions that this will line up as soon as you go, we're in this module, this is gonna line up with,
Well, we have to determine that.
oh. okay.
We're determining that.
That's supposed to-
So
okay.
the goal with this is that we can then say for certain, we have we have taught the standards and performance indicators that the state is saying we need to teach. So if we have one and we go through this whole process and we have standards and performance indicators that are missing, then we know where we need to fill in the gaps so that students get the content they're supposed to get. So, so it seems like a lot, but hopefully it's gonna be simple enough, and after we do it a couple of units, that it will be not quite as time consuming and a little bit easier, because you'll know what you're looking for. So, if we want to, I'll scroll to the next page. I mean, I don't know how. Just review it and just go through it and review it for. Does that work for everybody, that we look through this first section? But I don't, everybody's gonna kind of be in a different spot. So each unit is gonna start with a big idea. So it kind of gives you an overarching theme for that lesson. So this one's gonna talk about, you will experience many changes in your physical, mental, emotional, and social health during adolescence. So that we already know, because we looked ahead at the performance indicator, right? But that's already checking that box. So then it goes into talking about questions about sexuality. So what I would say is important is we have to be careful with the provisos as well as with the Comprehensive Health Education Act, what we're discussing and how we're discussing it. I mean, I guess I just come on out and say it, but like.
Well, and yes, especially with the proviso, and we know that some of that material is in this book, but again, we would edit it, we would block it so that they wouldn't have access to that information. So just know that the book is not aligned to the law. So you're gonna see some things that might be, and we're aware of that, especially with the proviso.
So do we want it, because everybody doesn't have access to a digital copy right now. But I want it.
You want to model it for us?
Sure. All right,
Or
so.
what you're thinking when you're looking.
So yes, so I'm gonna go through, and I may not read it necessarily word for word, but I'm gonna skim and make sure that the information that's in there. So I'm looking for certain keywords that I know are not appropriate. So I'm just gonna kind of do a once quick glance over, and then I'll go back through, because now I've familiarized myself with the content. And then I'm gonna go back through and do that line by line and really look for that information. Does that make sense?
Mm-hmm.
So like what would draw my attention is this questions about sexuality, because I know that there's certain things that I cannot say or do and talk about in the classroom based off of the Comprehensive Health Education Act and what the state standards are. And so I would probably stop there, because immediately I already know that there's things that I need to look at in there. So on this notes here, under lesson 1, I would probably note that, like, questions about sexuality, like you can just put a little dot there that I need to go back and kind of look at that. Then it goes into sexuality in your health. It explains what sexuality is. So I probably, because it's highlighted, will read the definition just so I have a context for what the book is referring to when they say sexuality, because that could be something different for everybody else. It does go into breaking down your physical health, mental, emotional health, and social health. Just as an aside, this book uses what's called the health triangle. And so those are the 3 sides to the health triangle. So you're going to see that referenced a lot in this book, because they start that in the middle school and carry it all the way through to the high school. And again, it's mentioning things like self-concept, which seems ambiguous, but again, if we're talking about people questioning or having a different choice of lifestyle, like those are things that I know that I can't talk about, so I want to make sure that that's not in there in any capacity. Then it goes into social health. So again, I'm gonna kind of skim that and make sure, you know, something like this where it says during this period, let's see if I can highlight it. During this period, you often begin to examine your values and beliefs as well as those of your family. And to me, you know, that's kind of leaving it open to interpretation. And so, you know, everybody's family's values are a little bit different. Everybody's beliefs are a little bit different. One of the things that we stress in health is that kids, as they go through maturity, right, will start to have their own ideas. They get that independence. And so just stressing the values that they and beliefs that they have and that of their families. Then it goes into making responsible decisions. And we do a lot with decision making. Just scientifically, we know that's the last part of the brain to develop in a teenager. And so we spend a lot of time reinforcing how to make good decisions and making responsible decisions. So there is a decision-making component in every lesson, middle through high school, just about, because we want them to practice that. And here it goes through the decision-making model. And again, this is consistent from the middle school to the high school. So you will see that in middle school material as well. So there are 6 steps to their decision-making model. Number 3 is the biggest one where it talks about, is it healthful? Is it ethical? Is it legal? And is it parental approved? And then goal setting. There is a standard for the high school about goal setting. Let's see, that they would promote, where is it? Yep, that they would set a goal for themselves to, that supports abstinence and discourages risky sexual behavior. So this is another component of our state standards, where they talk about setting goals and how being sexually active could impact those goals. Then, and that is basically that last little section. I would say too, each lesson has a review, and there's different components. There's just kind of like, for lack of a better term, sit and get recall that they would have to answer, but there is also the components of the thinking critically and then applying it. And those I think are important to read because it may again have them apply or think of situations that don't comply with our state standards. So it may say, you know, suppose you have a friend that is experimenting with XYZ, and that may not be in line with our state standards. So those are important parts to also remember, because I think it would be upsetting probably to a parent if that got sent home and it wasn't supposed to be a part of the curriculum. And then here it was coming in on their homework or their school assignment. So making sure that all the components are in compliance. Any questions? I know it's a lot.
Well, my question is, when the students are being taught this, are they using laptops to
Yes.
look at the material?
Yes.
Okay.
Isn't most of the help go via Edgenuity? Is that what it is?
No.
So
Well,
beyond that,
there were those health courses for,
I think my daughter, she was in 9th grade last year and she had like X amount of modules, like hours and hours and hours of modules.
JROTC,
Is that, yeah?
yeah.
That's where they got their health portion.
because they do, they have to have that health component. If they're JROTC, they're not PD, so they have that health component, so it knows what.
It's, this may not even be helpful, but it's just funny how the state is very conservative, and we've moved toward these med tech schools. And we're educating our students about You know, all of these careers that are gonna introduce them to a lot of stuff that we're not talking about, we're not moving, you know, with. And so it's just so restrictive.
What
in
you're
that
saying is
nature.
what you see in the emergency room, you wouldn't see in the text.
Yeah. I mean, we're inviting
What's gonna happen.
Well said.
Well, we're inviting them into the schools, you know, to come and, you know, not the schools, the hospitals, to come and shadow. We have clinics in the schools. And the practitioners are able to talk to them about their sexual health,
That's real
if
life.
they're, what is it, 14? So it's just so.
Seems like a confliction.
It's very,
Yeah.
very hard.
But we have to do
juggle.
what's under the auspices of the guidelines that are given.
Well, you know, when I reviewed the middle school, particularly some of the guidelines for sixth grade, you know, I had a lot of, you know, issues with that, but when I went through the high school, I had less concerns, but you mentioned, you know, that there are words and there are things that you can't say, or you shouldn't say.
Under the
I don't-
proviso, which we are not really clear on.
Yeah, I don't have any idea what those are.
Let's go back to it's in your notebook.
Yeah.
Okay,
We mentioned it briefly at the very beginning when we were in.
That's section 3 for you all, correct?
section 3.
Yes.
Yeah.
Comprehensive health education,
Yes.
that's under section 3.
But the
Let's,
provisos in a separate section.
Okay, the proviso.
oh, that's the
In
last
law.
section.
Yes, it's in the law.
It's that last section and it's the United States District Court, District of South Carolina.
Okay.
The consent decree and
There's a
judgment.
box in the left-hand
Yes.
side up the top left,
Section 3?
It's the very
Yeah.
last section.
under 4.
It's under 4.
Oh, 4.
4. Is this what you're talking about?
I think so.
Yeah,
Yes.
it has a back box up in the corner. The
That's
left-hand
under section 4.
Yeah.
For those online, if you have your notebooks, it's under section 4.
Oh.
And that's a specific
Language
word.
sources.
Yes. This, yes. This was from 2020.
So this defines what can be said and
This is the one component that until legislation meets again and legislators decide how we're going to change it, update it, because in the law, it's 593230 and it's number 5. That's just the detailed section, but in your actual law.
this is a court case.
Correct.
Yeah.
That's how it all.
What was the judgment?
We're waiting.
Yeah, oh. okay.
Yeah.
See, look at the page before, it's just the consent
Okay.
decree, and that just gave you the overview in that first paragraph.
Okay,
So when you go back to 593230,
You want me to read it?
yeah, it's in there, and so it's just like, it doesn't exist. Ignore it, until legislation readdresses, because they're the only ones that can make those changes.
So we can. Right?
Correct.
Okay.
Until it's updated
Right.
by the
So-
legislators.
What it's referring to, the 593230, section 5, says the program of instruction provided for in this section may not include a discussion of alternate sexual lifestyles from heterosexual relationships, including but not limited to homosexual relationships, except in the context of instruction concerning sexually transmitted diseases. So when we're reading about, like at the beginning where it talked about, and I don't know because I haven't read, but like that's what got my attention, where it talked about,
They receive their sexual.
yes,
And I think there is.
questioning about
module.
questions about sexuality.
Yes, there's a module in there. So the book is nowhere as conservative as what.
Yeah.
We are
Yeah.
following.
And it's in the middle school book as well. So that's where we know that that is not compliant with what what the state says we're to teach. So those are the kind of questions that as committee, we would have to present that information to the board and say, this is what it is, and then decide if we want to adopt, well, we're not going there yet, never mind.
We can make edits to this curriculum, but we need to see where the committee is going first. And then I'll give you the timeline of what the publisher options are, because I have spoken to the publisher about making, there are certain things in South Carolina, we are following our guidelines that cannot be taught. How can we make those edits in your published book? So those discussions have occurred just to prepare them and to see what our options are. So you don't have to take it necessarily at face value, what you're reading. That's why you're making comments, because there are some things that we can perhaps, address with the publisher, have an edited version of the same curriculum.
Well, let me ask this. I mean, this is a tremendous amount of material. And, I think that to go through all of this would take a significant amount of time, more time than what you need relative to, trying to get this in the classroom, all the second, appropriate for the two of you to make assignments to each of us on, the committee, and you give me a section and so forth, and then what I will do is I will focus on that section, and then when I'm finished with it, I would send it either to you or to both. You may disagree with my thoughts on this, and then we could have a discussion. And then, when we met again, then I would present my thoughts to the group. And then the group could say whether they agreed with me or not.
Yep. So that was, I want to assign
That's where we were.
the units
Okay.
to, the challenge is there's 27 units. I'm gonna stop sharing. So we have, 3 committee members online. And then we have 1, 2, 3, 4, 5 committee members here. So that's 8, and then we're missing some committee members. And I don't feel comfortable assigning. I don't know, I mean, how would y'all feel about us? My thought process is this, we're probably not gonna get to all 27, so do we just wanna assign a couple now for the people who are here? Reach out to our people who are not present so that they can get on board. And then, so, I mean, what would be a comfortable number? There's 9 of us here, no, 8, I lied, I can't do that, sorry. 2, 3, yeah, there's 8 of us. So how do we want to say, do we want to do?
Ms. Breyer. Dr. Strider.
Breyer. Maybe an opportunity. I think the high school may be a little more complex than the middle school.
Yep, I agree.
So when I'm learning how to drive, I please don't make fun of me, but I want to do automatic before I do stick shift.
Yes,
Come
ma'am.
out of me. All right, it's just, it was easier. So maybe the middle school person
Okay,
walking through that lesson live. For some who haven't cross-checked to do confirmation to the rubric back and forth. Model it, I do, you do. And then probably we do, you do.
I agree. I was gonna say, if they're not here and they're not
They're gonna
like,
be lost.
you weren't able to,
Yeah, yeah,
you
it's gonna
walked
be-
through it
yeah,
really
well,
well.
I agree, that's why I'm saying like,
It's getting to assigning
right,
prior to knowing my mastery of practice.
right.
Will end up with greater conversation on the back end.
Right.
And I think we have to realize that when it's very specific as for the legislation for the committee.
Yeah.
Because there are a lot of units, but not all the units
Right,
or as detailed
Right.
what is required. And any change made will have to go to the board, and that is when they either say, hey, yeah, all right, we kind of like it, or hey, let's. But any changes, so I just, maybe we can do an I do. first.
okay,
Okay, sorry.
you're fine.
Back my division.
And
Go ahead.
that's a question.
Hi, so when we received all this information via email last week, I did my due diligence and I took my weekend and I went through as much as I possibly could because that's what I assumed we would be doing as committee members. Did I read everything? No, but I went through a good portion of it. I would be perfectly fine with people being assigned, maybe middle school versus high school. I can't hear you guys very well, so if I'm repeating something somebody else said, I apologize. And third, when I signed up for this committee, I have 4 kids, 2 jobs, and a whole bunch of animals and a husband. You know, this is the 3rd meeting in 6 weeks that we're having. We were told it would be once a month. So I don't know if meeting again in 2 weeks to discuss these books is like beating a dead horse, especially when we don't have the law yet. We don't know what the law is. That's my 2 cents for what it's worth.
When you're here at the table, it's easier because the mic is the only one up here.
I do
So-
apologize.
No, it's not just, so as we talk at the table, we all have to, we don't have a microphone, so we can speak up so that everyone online can hear. Were you able to hear me, Angela?
Yes, ma'am.
Okay. So yeah, everyone would speak up, so.
And the part about the conservative state and the things that they're being introduced to as they're older, you know, there are a lot of conservative parents in the district, more than you would probably assume. So I think it's important that we follow the guidelines that are coming down from the state, whichever way they go.
Parents have to agree to this. Do they have the right to say, no, you know, you can't teach my child?
Parents always have the right.
Yeah, so at the beginning, before you teach the course, you will send a letter home and communication to the parent that, hey, we're getting ready to teach this unit. This is what's in the unit. They have access, once approved, to review the materials, and then they can opt their child out.
And I have another question. I didn't see this in Rubicon. Is there a reason I have it up there yet?
If you could hold on for a moment, Dr. Stratus is speaking.
Yeah, I just want to build on the opt-out. I believe are there 2 concepts within Aaron's law and Gavin's law that an opt-out
Correct.
option is not available, but
Correct.
it is with
Correct.
regard
Correct.
to other components of the curriculum.
Right.
That a student has the right, as a parent, has the right to request alternate assignments for, with the exception of Aaron and Gavin, correct? Right,
Thank you.
yes, ma'am.
Alright.
She had something else.
Did you have a question,
So
Angela?
now I'm unable to check in Rubicon. I can't see it in Rubicon, these standards. Is there a reason?
Not there yet because it's not approved yet.
Thank you.
We haven't reviewed it, excuse me. So that's what this committee is doing, is reviewing. And yes,
Figured
once
I'd-
the review happens, we have been meeting more, but we've had to meet more to be able to get the materials to get to this point. So we had discussed at our last meeting that there would be probably a need to meet a little bit more frequently up at on the front end, and then eventually, yes, we would not have to meet as much.
Okay, thank you.
All right, so you want me to do a middle school? I just feel like it's like a lot of me sitting here, so it's just no fun for anybody. All right, so this is the middle school side, and you'll see that it says Teen Health rather than Glencoe Health. Here is the supplement. So this is just my teacher brain. They have 4 modules. The first one is 0. And it's this, your health and wellness. I did not include it as one of the units because it's also in the textbook, the exact same 3 lessons or 5 lessons are in the textbook. It's the front matter of the textbook, and it's not necessarily specific to reproductive health. The only thing that is mentioned in there is it's the same thing as far as your total. It talks about the health, it introduces them to the health triangle, it introduces them to making decisions and what influences their health, risk factors, building health skills, making good decision, the decision-making model, setting goals. And then it talks about choosing health services, like questions you would ask a doctor if you had to go to a specialist, or it talks about health insurance versus nonprofit organizations and government assistance. So I did not include it in here. If the committee feels like they want to review that because it is in the supplement, I'm happy to add that in there.
I just have another question. Something that was received on the email was click on the wall and went in, it was a document in the middle school.
Yeah,
For, it was like 130 pages.
that's
Is
probably
this-
this.
That's what this is, but broken down looked like different. I see one of 21, it was straight up one of 130 pages, and I went through a lot of that, which looks like a lot of what this is.
Okay.
So I just, in my thoughts, is that totally different of some stuff I looked at online for, many hours.
So
Trying to see what that link was.
Is it the difference between the sexuality component and the health things?
well, this looks like it's just a supplement.
Understood.
Yeah. I don't see the textbook in here. This is just the reproductive health supplement. It's not the text.
Right. But I wonder if the component that she was looking at was the text.
If it was 130 pages, it
Because
was probably.
the state adopted, the state adopted resource, they, like she said, they come 3 different ways. Either people just get the health resource, which is what the book is that we were looking at. They can do the sexuality component supplement.
Okay.
Okay, and then they also have on there the whole shebang, the curriculum, the health curriculum and the component. So the big long one is the whole complete package.
Well, this is a little tricky because on the form that you so nicely made, it goes supplement, textbook. So we would have to go back and forth or
Well,
just,
we don't have the text. This is her login that she sent. It's only the supplement. It's not the textbook. Too.
Okay,
But in the textbook, there are reproductive health components.
correct. So we just want to make sure that those are included.
But they don't have access to them.
If you assign me something and I can't find it, I will check.
Maybe for that.
So they'll only be able to do the middle school supplement.
Correct. But.
I think it's on McGraw Hill then. I mean, I can pull up mine, but they're not gonna have.
I mean, the group,
Because there's a.
well, I read what you read. So did you. I read what you read.
I think you've given us the basic guidelines of what it is we need.
Right, but you're not gonna, but I thought we wanted to split it up, right?
Yeah,
yeah.
hopefully.
Middle school.
The middle school one.
And, y'all can, whatever you think the appropriate
Do
division.
we need to edit it again?
Well, what I was gonna say is I'll just assign them the 3 supplements until we get access to the textbook. And there's 8 of us, so that's 2 to 3, two groups will have 3 people review, and 1 group will have 2.
And, you can put us in groups if you want, but
Well,
this is an individual.
Well, right, okay, so let me clarify, I apologize. when I say groups, that way it's not just one person's opinion coming forward. We have multiple opinions so that if I review it and you review it, you may see something different that I don't. And so,
Present it to.
correct,
you,
correct,
Mhm.
yeah.
Whatever, however you want to.
And then that way it's, you're working on the same thing, but you're not necessarily working together.
So
Right,
it's
so
an
if-
independent review.
Right,
Okay.
but but we'll have more than one person looking at it so that it gives that unbiased opinion so that we could hear multiple perspectives and then discuss it.
And how do we access this supplemental module?
That's what this is, the link that Ms. Cushenberry sent out, it's right here. This is the middle school platform.
So it should be on your
Okay, so
email.
Exactly.
Yeah.
So it was a supplemental side. I was only doing that side like that. Well, we both say supplement from here.
Yeah.
But anyway, we'll continue on.
So that being said, the sixth grade at the top, the first two are the supplement that you have online resource to, and then the second to last at the bottom is the supplement that you have online access to. Does anybody have a preference for which one they get? All right, we can
The
just,
first to supplement.
you only,
Go ahead.
you only needed, because we're gonna have 2 to 3 people doing
The
each
first
one.
module,
Okay,
the 10 years,
okay.
Wanda Glaze.
All right.
I'd like to do sexual feelings and relationships.
Sexual feelings and relationship with Cindy.
Dr. Pierce, do you have a preference?
No.
All right.
Consign.
So we'll have you do the reproductive system, if that's okay? It's number 2.
Supplement module 2, right?
Grade 6 rad.
Yeah, okay.
Since I had issues with what, they were, showing for grade 6, maybe that's.
We don't want it in text.
I'll do the reproductive system.
Okay. All right, and then online, Angela, do you have a preference?
I do not.
All right, we'll have you do the teen years if that's okay.
Perfect, thank you.
All right. Susan?
No preference.
Oh, no preference. All right. We'll have you, I'm just gonna go in order, have you do the reproductive system.
So you have 3 people
Three people doing
doing that.
Well, we're going to, because there's
Okay.
only 3
Okay.
units
Gotcha.
and 9,
Okay.
we'll have,
Okay.
8 people. Yeah, so,
Okay.
then Pastor Michael.
Yes, ma'am.
All right, we'll have you do, the bottom one, the sexual feelings and relationships.
Okay.
And then, I'll do that one too.
So what's left?
Oh.
So, well, but everything that's left is the textbook,
But we can get it online.
but they don't, but right now they don't have that.
I will get it.
Oh, okay,
I'll find a way.
all right. I was like, they don't have them.
I'll make sure they get.
However you want to do it, you can,
So
make
we
these
can assign more
assignments.
than 1 unit. Okay,
You'll have to.
Yeah.
all right.
You can assign it, you can send it to me
And
tomorrow.
is this
however you
middle
want to do it.
school helps?
Mhm.
Just making sure.
Yes.
Yeah. The high school has everything. The middle school just has a supplement, yeah. All right, so that leaves social health. Does anybody have a preference for social health?
Put me down, please.
Um. Oh, I see. Okay, I'll take myself off of this one. Miss Susan?
She's there.
Okay. I'm gonna take you off of the reproductive system just because we're assigning more than one. Are you okay with me putting you on the life cycle?
Sure.
Sure.
Okay,
You know, I'm with Angela. I had no idea that this was part of this. So I'm not even certain I can stay with this. I'm sorry.
okay. So then and I'll just take her name off.
I'm sorry. This is
That's okay.
not, I'm in graduate school. This is not, I'm sorry.
That's fine. I get it. Been there. All right. Yeah. All right, so, Angela, is there a second unit that you would have, be interested in?
Whatever is assigned, I'm fine.
Okay, I'll have you do the life cycle if that's okay.
On it like white on rice.
Pastor Michael, is there a second
Yes, ma'am.
unit that you would,
Whatever you assign me.
all right, I feel so awkward assigning adults. Students, I don't care, you can do it.
Social health.
Yeah, Pastor Michael, let's have you do social health.
And this will be in the textbook.
Yes, sir.
Okay.
Yep, we're
First
gonna get the link updated so that it includes the textbook.
All right, the first one's in the supplement, the second one's in the book.
Correct.
Okay.
And I'll send you the link out or once I receive it. I'll email you the link.
For the body system, it's only that one lesson that covers the endocrine system that's part of our reproductive health. The other, okay,
Who's that?
Me.
same thing with the next one. It's only the one lesson that talks about sexual harassment under bullying and cyberbullying. Then we have communicable diseases. That's fun.
I'll do that one.
Okay, so you'll do 3?
Yeah, I'll do it. That's it.
Yeah, I've got you
already
both
have
down.
three. Oh, okay.
Yeah. So, same thing with safety. Lesson 4 specifically talks about personal safety and online safety. And so part of our standards has to do with human trafficking and online safety. So that's why we included it, for our units. So it's just that one lesson 4.
I'll do it. I'll say, yeah, so I will have 3, okay.
I haven't put myself down for anything, so I can do dating, relationships, and abstinence. And that's it for middle school.
That's all we're doing here. You get.
Let's tackle one.
But yeah, Dr. Stratos suggested that we do middle school and
Yes.
get our
in the
feet wet with
groove.
that, yes. And I agree, right? It's like, you know, you go from riding a big wheels to a tricycle, to training wheels and a bike, right? So, anywho, if you get into it and there's any concerns, please don't hesitate to reach out, or if you have questions, please don't hesitate to reach out to me. I'm happy to assist. This curriculum specifically, I'm very familiar with because this is my grade level that I teach. So if you have any questions about anything, then I can easily help you navigate through and find.
I have a question when we come back. Depending on what we were assigned, what we'll look at is the notes by each one, and then we have to go back and look through all of these.
Well, this was just, yeah,
For our.
Yeah,
Okay.
but so for whatever one you're assigned, you would go through the packet and find. So for example, Miss Glaze and Angela have the first one. So they would fill out the first section until you got to the next on just this one unit or module. Then they would go whoever, so Dr. Pierce, you have reproductive system, so you wouldn't have to worry about the first section. You would just go straight to the reproductive system. And it tells you at the top what module it is and what the title of the unit is, so that you, and then it lists the lessons specific to that module. So that's what you'll fill out and then check off any of the performance indicators.
And where it says textbook, you're gonna send those.
Yes.
Yes.
Tomorrow I'll get the link, from Gulf, and then I'll send that out to you in email. Like I sent the other stuff to you.
I think it was maybe the second meeting we had numbers and emails. What's your
It's,
number?
it's in here in your.
I got so many pieces of paper.
I know.
You just giving you a
Well,
number?
because this is being recorded, I would prefer to not say my
Okay,
name and number,
alright.
but we can get it to you.
It's in this book.
It's, yes,
There's a
it's in the
sheet with all
first
of it in
section, it lists everybody's
And then you
name and,
got-
yeah.
That's where to be.
Yeah.
That sounds good. All
Yes.
right.
Get everybody calling.
Yes.
Look, I've had this number
Got
since
it.
1990. I don't wanna
Mine
lose
was
it.
wrong, so if it didn't get updated, nobody has mine.
I sent out, I did email out an updated list, but if I need to send it out again, I can email out. Just so it's on the top so that you don't have to look through your emails, I will send out an updated, contact list.
And please forgive me, what's your name again?
That's okay, Amy Pryor.
Thank you.
Yep. So this is a lot. And I so personally appreciate everybody. As a teacher, it's still a lot. So I can only imagine for somebody who has another job and teaching is not your profession, you know, it's a lot to take in. So I really appreciate the personal commitment and your service to our students and this community serving. So thank you all for being here. We do need to set up another meeting and future topics. Future topics to me is we're gonna share out and review, you know, the material that we've reviewed. But if anybody has anything additional that they feel like needing to add, don't feel like you have to have it right now. In their bylaws, it says that you can notify Ms. Cushenberry ahead of time and it can be added. So it doesn't have to be in an official capacity to add it to the agenda. So as you get in this and you go, oh, well, I want to talk about this, just reach out to Ms. Cushenberry and she can add it.
Small little agenda. After the Pledge of Allegiance, one time we did a moment of silence, if that could be on the agenda.
Oh,
please.
yes.
Moment of silence, please.
Yes, ma'am. Okay, so has everybody got their calendars? You know what? What would be a good time frame? 2 weeks is Labor Day, so that's obviously not an option.
That's not a good option for the night.
Yeah. Is there a better week that you don't have 3 other board things going on? So we don't do this to you again.
That's gonna be always. So we have September 16th, the 23rd, or the 30th.
16.
16th.
I can do those.
Any 16th, the 23rd, or the 30th.
16. Well, it's up to the committee,
Right.
how much time.
Pastor Glaze,
I like the 23rd only because I'm getting ready really soon to go out of town and I will not be able to look at this at all, so the 23rd is a better date for me.
Does the 23rd work for the majority of you?
No, I will be in the Bahamas.
Oh, you're in the Bahamas.
Yep.
Does the 16th work for you?
Yes.
So how many people are available on the 16th? Because we have to have a quorum.
I can do that.
Available, and if I haven't got my homework done, I'll let you know.
I can do that.
You don't have this one. I need to have at least 6 people who can be available on the 16th for a quorum.
4, 5, 6,
Five,
yeah.
Okay.
6.
Okay,
So we're gonna say the 16th.
the 16th at 5 o'clock or
Is 5 o'clock still a good time for everybody?
4:30, okay.
And again, if, I'm happy to assist, so if you run into, don't feel like you have to wait till the 16th to ask a question or get clarification. So. Don't let that impede your process. Okay, so do we have a motion to adjourn?
By unanimous consent, you can do.
All right, thank you guys, everybody online and here present. Thank you, you as well, appreciate your time.